So coming to myself now, I qualified in 1984, and you can see there some of my colleagues in the students in the same year as me. Note they're wearing tie and white coat. And of course, that's now gone out. And we'll be talking about comparisons over time. It's now short sleeves and open neck collar, no white coats. Medical student time was great. I was involved with the Edinburgh Fringe Festival, went cycling, and really enjoyed my time as a student. I lived in the East End of London and went to the London Hospital, and the Isle of Dogs was where I was staying. There was one building standing up on the Isle of Dogs. It was all desolate wasteland. And that one building was deemed unfit for human habitation apart from students. So it was great. Used to scrape the frost off the window in the morning and look out onto the deserted dockland and see the birds there and the riot police training. I really enjoyed it. So we came to 1990. 1990, I went to Australia and I worked as a registrar in cardiology and worked in the A&E department in Perth in Western Australia. Between 84 and 90, I'd worked in various hospital jobs. I'd qualified as a hospital consultant, and I decided that actually general practice was the right thing for me because I could do everything and I needed to know everything rather than specialize in one particular area. So I moved into my GP training in 1990 after I got back from Australia. And then I did a little bit of work as a locum and then joined the practice in 1991. And you'll see here a picture of the lakes in Lakewood Road. And my wife was feeding our second born just by the lakes as I went for my interview. And I came back and told her I got the job, and we were delighted. And then we both went for trial by sherry, where you meet the senior partner in their house and you all have a glass of sherry and say hello to everybody. So on the next slide, you'll see the range of conditions that a GP saw at that time, and indeed today, is very similar. I was looking after babies, and I've run a baby clinic all the way through my career, and it's the delight to see the 6-week-old babies giggling and laughing and looking at you. And that's probably one of the reasons why I've now got 3 children as opposed to 2, because I enjoyed it so much. Of course, what we also deal with the stresses of middle age and older age and palliative care. And I've had the pleasure of seeing my babies grow up and become adults and have their own children, which is really nice, or the adults grow older. And you'll see on the picture at the bottom in a minute, next slide, is the school gates. And of course, I'd meet a lot of my patients at the school gates. I lived on site, and I still do, like Dr. Ritchie did back in 1897. And therefore, I would have a consultation sometimes, but I would say it's confidential and we need to meet at the surgery afterwards. And initially, I'd see mostly mums and babies. But as I got older, I grew older with all my patients. And so I met them at other stages. And now I see more middle-aged and older. And next slide. You'll see that one of the consequences of being in your own area and living in your own area and meeting patients is you meet them in the supermarket, which is slightly awkward if you're buying alcohol for a party and you've just given advice to someone to cut down their alcohol. 2 consecutive weeks that happened, but not since then. So on the next slide, you'll see it's not actually my wife, it's a stand-in for me, but she was looking after our baby child at the time. This is our second born now, it would have been. But she had to be acting as a receptionist for me, again, like Dr. Ritchie would have done in 1897. She had to contact me by pager. There was no telephones in those days. So if you look at that next slide, you'll find the pager appears. And your next slide, you'll see that my mobile phone appears. And that was the sort of state of play of mobile phones in those days. Obviously, we didn't have one. So I had to go to a patient's house and ring from a patient's house. And sometimes that could be difficult if the phone was a bit damp for some reason. But anyway, we carried on with that. At that time, I had working an 8-to-8 day, roughly. 38 appointments, 19 patients in the morning, 19 in the afternoon, with extras. But the things that we saw were much quicker and briefer. It was one thing usually, and it'd be fairly straightforward. And we'd have in the middle of the day 2 or 3 visits. And then on top of the surgery, I'd be doing a duty call, and I might be called up for a heart attack or a stroke or somebody who'd had an injury. And that would be on top of the normal routine day. Now we have a duty session and we don't run a routine surgery. Other people help with the visits, and we see about 12 to 15 appointments in the morning with no extras. So it's changed the pattern. But the appointment numbers have increased, I hasten to add. As a doctor, I was doing the duty calls and the surgery, but also I was looking after a list of 2,000 people and all the paperwork associated, looking after them and making sure they're okay. And on top of that, I'm the manager looking after the practice alongside our practice manager. So a GP is doing 3 different roles, and they still are today. A salaried GP might not do the management, but they might still have a list. Back in those days, the practice manager carried all our paperwork round in a plastic bag. There was no other bits and pieces needed. It was very straightforward. Now we've got an administrative team of what may be around about 10, including Louise at the back, who's very kindly helping with the PPG.